Hello, my name is Penny Cartledge. I'm a student at Maryville University, and this is my head-to-toe assessment video for advanced health assessment. My patient is Christy, and then prior to Christy coming into the room, I had the nurse get a full set of vital signs. I had her include a height and weight on that. She also did the far vision test with the Snellen chart and the near vision with the Rosenbaum chart. We had her empty her bladder prior to coming in. As she came in, I noted her gait was normal, and throughout the exam I will pay attention to her emotional status, her language skills, cognitive behavior, and such. I have washed my hands prior to the examination, so now we'll get started. So the first thing I want to do is look at her head and face, and I'm first going to inspect and look and note that all her facial features are symmetrical. Her skin is pink. Her eyes are set well. Her ears are set normally. And then next I will palpate. I'm going to first start with the scalp. And I don't know any lumps or deformities on the scalp. Through this process I'll note the hair. She has good distribution of her hair. It's clean, it's fine, it's very curly. I'll go on and palpate her facial bones. I don't know any deformities. I'm going to palpate her sinuses. This is her frontal sinus and her maxillary sinuses. Do you note any tenderness there? No. Okay. All right. While I'm here, I'm going to go ahead and check sensation. Can you feel that? Yes. On your forehead, cheeks? Yes. And your chin? Yes. Okay. And then next we'll move on to her eyes. And when I look at the eyes, I'm going to note that she has good distribution of her eyebrow hair and her eyelashes look good. Her sclera is clear. Her conjunctiva is pink. Her pupils are about 4 millimeter. I'm going to palpate the lacrimal apparatus. I don't note any masses or bumps. I'm going to have you cover, if you'll cover one eye, okay, and then cover the other. Okay, that's good. And then next, let me check her, I'm just going to use the ophthalmoscope to check for light and accommodation. If you'll just look straight ahead, I'm going to note her pupil size with the light for accommodation. I'm going to do this side. And that's good and normal. And while I'm here, I'll check her red reflex. That's good. Okay. All right. I hope I didn't blind you. Now, let's go on to the ears. And as I noted before, her ears are aligned well, according to her eyes there. I don't note any lesions, any sores, any rashes, any redness on the outside of her ears. I'm going to palpate. No knots, lesions, bumps noted. Her ears are a good color. They're warm temperature. I'm going to go ahead and check the internal ear. Her canal is clear as cerumen. She has a good tympanic membrane, pearly gray, no bulging, no redness. I see the bony landmark. And the same on this side. Okay. I'm also going to check her hearing while we're here. I'll do the whisper test. I'm going to whisper something to me and you tell me what I whisper. Hello. Goodbye. Okay. And we'll also do the Weber and Rennie test. So the first thing I'll do is I'll place this on top of your head and you let me know whether you hear it equally in both ears. Yes. Okay. And then next we'll check air and bone conduction. The bone conduction will be when we place it behind the ear, and then we'll change to outside the ear. And you tell me when you do not hear it anymore. Okay. Again.
Okay.
Okay.
Okay. Okay.
Okay, very good. Okay, let's move on to the nose now. And again, I look at the nose as I did when I looked at her face. I'm going to palpate. I can use my speculum to look up in the nares, and the turbinates are pink. There's no excessive drainage. Her septum is midline. I'm going to have you push one side, breathe in and out through that nare, and then do the other side. So we check for good nasal patency. Next, let's move on to your mouth. And I note that her lips are pink. There's no cracks or fissures or anything like that. Let's set this to the side. And I'll have you open your mouth. I'm going to look at her tongue is pink. Her mucosa is pink. Let me see your teeth. No receding gum lines. Her teeth are clean. I don't see any missing teeth. And then I see her uvula, her tonsils. Oh, there we go. No redness. Can you say ah? Okay. And this is the gag reflex. Okay, next we're going to go on to the neck, and I'm going to look for smoothness and symmetry of the neck. I don't know any bulging or anything that looks like a mass or a goiter on her neck. I'm going to palpate, feel her carotid pulses, and I do that one side at a time. Let's check her trachea, make sure it's midline. It is. And then we'll check her thyroid at this time. So what I'm going to do, I'll push to one side and have you swallow, and then we'll push to the other side and have you swallow. Okay, go ahead and swallow. Okay. And I don't know any nodules or masses or anything with that. I didn't feel anything when she swallowed. Let me check her lymph nodes, her preauricle, postauricle, occipital, her superficial cervical, posterior cervical, there's the tonsillar, submaxillary, submental. And if you kind of shrug your shoulders forward, I'll check the supraclavicular. I didn't note anything there. I'm going to also check the range of motion in your neck. If you'll look down and up and turn side to side. Can you shrug your shoulders and put resistance? Okay. And push against my hand. And again. Okay. So she has good muscle tone and she has good range of motion in her neck. I also need to auscultate to make sure there's no bruise. First, I'll auscultate over the thyroid. Okay, that's good. And then I'm going to have you hold your breath. Take a deep breath and hold it. Okay, you can breathe. And let's do the other side. Same thing. All right, very good. And there's no bruise noted in the neck. All right, let's move on. I'm going to look at her upper extremities. So I'm going to note that there's good muscle tone in her upper extremities. The skin color is good. She's pink. Her nail beds are good. Her nails are clean. Her calf refill is within normal limits. Both hands. I'm going to feel for a radial pulse. Both sides. A 2+. Brachial. That's good. I'm going to have you pull it in. Okay, push. Okay. And then hold your arms out. She's got good range of motion, good muscle tone, good strength. And then next, I'm going to, let me check her epitrochlear nodes while I'm here. And I think I'll go ahead and check axillary while I'm here as well. Okay. Now, I'm going to look at your posterior side or your back. I'm going to have you turn to the camera. And in a normal exam, she'd have a gown on and we would expose the skin. And I would look for any skin rashes, lesions, deformities, anything like that, which I do not note any. I'm going to palpate. I'll just palpate down her spine, her scapular area. Note any tenderness. I'm going to percuss over the costovertebral angle. Any tenderness there? No. That's where her kidneys lie, so that's good. There's no tenderness there. Now I'm going to go ahead and percuss over the lung field. Put your arms, there you go. That opens it up a little bit so we can move the scapula out of the way. And we do this in a systematic way. I'm going to put my hand here on about the 10th intercostal space, and we'll check her thoracic expansion. You can take a deep breath for me and let it out. That's good. Let's check tactile firmitus. If you could say 99 for me. 99. Say it again. 99. And one more time. 99. Okay, that's good. And the last thing I want to do on the back is our diaphragmatic excursion. And I'm just going to demonstrate this on one side due to time constraints. However, we would typically do it on both sides. And what I'm going to do is check the level of the diaphragm with a deep breath in and one with when she blows all her air out. So first I'm going to have you take a deep breath and hold it. Good. All right, and then I would mark that with a pen. You can breathe. And then I'm going to go up to check when she exhales. So take a deep breath and then exhale and then hold it. Let it all out and then hold it. Very good. And then I would mark that. A normal space would be a 3 to 5 centimeter space, which she has, and that's normal. Now I'm going to percuss on the lateral side. We don't want to forget the size of our chest. That's good. Let me grab my stethoscope and we'll now listen. We're going to do this systematically. So deep breath in and out. Again. 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 And again. While I'm here, I'm going to go ahead and listen on the lateral side as well. Big breaths in and out. And again. She has good lung sounds, no adventitious sounds. All right. Now I'm going to have you come back to the front again. We're going to do the same process just on the anterior chest now. So I'll expose the anterior chest. I'm going to look again for any skin rashes, contusions, anything like that. I'm noting as I'm doing her posterior and anterior chest that her respiratory rate has been around 14 to 16 breaths per minute. No labored breathing with anything that we've done so far, a good regular rate. I'm going to palpate her chest. I don't feel any deformities, especially around the sternum there. And then let's percuss. Okay, that's good. Now, let me go ahead and feel for how I'm feeling. This is for precordial. And let me feel down here, because we're moving into the heart. I'm going to feel the apical heart. I can feel that there. So first I'm going to listen to her lung sounds, and then I'm going to move into the heart sounds. Deep breath in and out. Okay, I'm going to have you breathe normally while I listen to your heart sounds, okay? This is our aortic, pulmonic, Erb's point, tricuspid, and our mitral. She has a good heart rate, regular rhythm, no murmurs auscultated. All right, now let's move on to your abdomen. If I could have you lie down. Are you comfortable?
Yes.
Okay, good. Now for the abdomen, same as anything else, I would expose the skin so I could take a good look. I'm going to shine a light on her abdomen to look at the contour, which is normal. Make sure I don't see any pulsations, any movement, which I don't. I'm looking at the skin. I don't know any scarring. I don't see any rashes, any contusions. It looks pink. On the abdomen, we auscultate. This is the second thing we do. I'm going to auscultate her fourth quadrant. While I'm here, I'm going to go ahead and auscultate the aorta, her renal arteries, her iliac, and then her femoral as well. And I don't know any bruise or hums. Okay, next I'm going to percuss. I'll percuss all of the abdomen here and all four quadrants. I'm going to note when I percuss over the spleen, the dull sound that it makes. And then for the liver, we're going to percuss a little bit differently. I'm going to percuss so I can feel the edges of the liver. So I'll start down low, and I'll percuss up till I hear the changes of the dull. Okay, right there, and I would mark that with a pen. We're going to do the same thing, start mid-clavicular on the fifth intercostal. Anchor down. Okay, and we would mark that, and that would be our upper border. That would be about a 6 to 12 centimeter range would be normal, which she is. Next, let's palpate. I'll start with a light palpation. Any tenderness? I don't know any masses or anything unusual. Then we're going to go to a deep palpation where I can palpate where the liver is and over by the spleen. Palpate low to make sure I don't feel any masses. And then we'll palpate for your kidneys. Each side. Okay. And then while I'm here, I would go down here and palpate her femoral pulses. Okay, and then I can feel and see if I can feel the aorta there. Okay. Now, I'm going to have you raise your head a little bit like that. Okay, you can relax now. What I was looking at is her abdominal muscles, and to note if there was any bulging when she raised her head up, which we did not see. That's a good sign. So now I'm going to move on to her legs and feet. Same as with the upper extremities, I'm going to note the muscular tone is even on both sides. I'm just going to raise your pant legs up, okay? I am going to look at the hair on her legs, which she's clean shaven. That's nice. And, but there's no shiny skin, no edema, nothing like that unusual. I'm going to look at her popliteal pulses, or palpate, I'm sorry. Both sides. Let's do her posterior tibial. Good pulses. And dorsalis pedis. Okay, that's good. She's got good capillary fill in her feet, good clean toenails. I'm going to push on my hand and up. Okay, that's good. Let me check. I'm going to move on and check sensation here. Tell me if you feel sharp or soft. Sharp, soft, sharp, soft. Okay, and that's good. That's intact. All right, now I'm going to have you raise up. You're doing good so far. Okay, so that was checking sensation, and that's also part of the neurological assessment. Part of the neurological assessment is cranial nerves. So let's just go through the cranial nerves. We have checked some of those already, but we'll just go through them. Cranial nerve 1 is our olfactory nerve, and this is the smell. We won't test that today. We don't usually test that unless we have a problem. Cranial nerve 2 is our optic nerve, which was tested prior to coming into the exam room with the Snellen and Rosenbaum chart, and she did fine on that. Cranial nerve 3, 4, and 6 kind of go together. That's your oculomotor, trochlear, and abducens. One thing we do need to check with that is the movement, the muscles in her eyes. So we'll check your cardinal gazes with this, and what I want you to do is just follow this Q-tip, okay? Okay, that's good and intact. Let's move on to the trigeminal nerve, which is cranial nerve 5. And we did that some when we did the cotton ball to her face, but I'm also going to do that with, have her clench her teeth. This show your teeth, and I can feel the musculature here. Also, I did forget this earlier, the temporomandibular joint, I'll have you open and close your mouth. There you go. And I didn't feel any crevices or anything there. Okay, let's move on to cranial nerve 7, which is a facial nerve. And we noted throughout the exam she has good symmetry in her face, but we want to check a few more things. I'll have you wrinkle your forehead, squint your eyes, puff your cheeks out. Okay, that's good. Let's see, what are we on? Cranial nerve 8 is our acoustic nerve, and we tested that during the ear exam with the whisper test and the Weber and Rennie test. 9, that's our glossopharyngeal. So that's the taste buds in the posterior part of the tongue, which we won't do a taste test. But it also coincides with cranial nerve 10, which is the vagus nerve, and we elicited her gag reflex earlier, and that is intact. Cranial nerve 11 is our spinal accessory nerve, and I did that as we did the shoulder shrug. Go ahead and shrug your shoulders to the resistance, and that was intact. And then the last one is cranial nerve 12, and that is your hypoglossal nerve. And I'll have you stick your tongue out and move it side to side, and that's intact. Good job. So, last thing I want to do is finish up the nervous and the musculoskeletal. And let me check your reflexes. This is your brachial. And then your knee, and then the Achilles. Okay. And then to finish, we did note her musculoskeletal throughout the exam with her neck, her upper and lower extremities. I'm going to go ahead and look at her back again, at the curvature in her spine has been normal, and in her C-spine and her lumbar spine. I'm going to have her lean down forward so I can assess the natural curvature of her spine. There's no deviation. That's good and normal. And I think we're done. You did a good job. Thank you.